Good evening and welcome back to our Skin Deep sessions. So today I'm going to do something a little bit different. Today I'm going to do a treatment on Sarah. Sarah is our aesthetic nurse, in case you haven't seen these sessions before. Sarah's got a couple of broken capillaries, little thread veins on the corner of her nose, and she's also got a little blemish on her face. So I'm going to treat both of those today, and also going to talk about it, how we get them, how we can potentially prevent them, and all the in-betweens. Zoe is on the camera, so you won't be able to see Zoe today, but you'll definitely be able to hear her. She'll be asking us some questions, and obviously she needs to be holding the camera so that she can zoom in so that you can have a look and see what we're doing. So I'm going to talk a little bit now about the broken capillaries and the method that I use. So there's two different methods that you can use. You can use what I'm using today, which is a thermocoagulation method. And what that does is it breaks it down so that the body will naturally absorb it. We also do an IPL method, but I find it's not as good for just the thread veins. IPL I find is good if you've got sort of more rosacea going on there, whereas the thermocoagulation is not so good for rosacea, but it's good for the broken capillaries. Now I use a very, very fine gold needle, and that gives an electric current and a heat, and hence that's why it's called thermocoagulation. So as I work, what I have to do is trace along the surface of the broken capillary. It doesn't actually penetrate the broken capillary, it sits on top of it, and that heat then will just allow our bodies to disperse it back in.
So does that mean it's breaking down the capillaries?
Yeah, so it'll break it down. It'll solidify it, and then our body will then naturally disperse it. Now, when somebody's got a lot of broken capillaries or any red blemishes, cherry angiomas, anything like that, it's not an instant fix. It takes a little while. It takes a bit of perseverance. Now, some of them will go straight away over the next few days. But they're also very, how can I put it? They're quite tricky in that you could leave here today, you'll be a little bit red where I've worked over you, but you can wake up tomorrow and think, oh my God, my skin looks amazing, you've got rid of them. And then it's like they're really cheeky, and then in a few days' time they just pop back up again. And it's because I have to work over the complete length of it. Now if I miss one minuscule feed to that broken capillary, it'll just feed itself and it'll reappear again. So hence it can take 1 or 2 sessions. Somebody who's got obviously quite a lot, some people are prone to them and they have quite a lot over their face, then it's very hard for me to work more than 20-minute sessions at any one time. And that's purely because your face tends to go red, so it's very hard for me to actually see the broken capillaries. So 20 minutes is usually the sessions I tend to work in.
So when someone's booking in, do they need, if they've got like a couple of different things, can they book just like one medical removal appointment, or do they need to book a different appointment, like per concern? Like, how does it work?
Well, I tend to work, I mean, if it's the first time somebody's been, I tend to first do a consultation anyway. So we do the consultation first and they have the choice to go away and think about it, or we can get on with the treatment. Now, it all depends on time.
Yeah.
Obviously, if you've got, say, broken capillaries and you've got quite a few of them, then really that session would be taken up just by the clearing of the broken capillaries. If you've only got sort of, let's say, for instance, a little red blemish there, and then you've got a skin tag or a mole that you wanted removing, then potentially I would have enough time to do the 2 of them. The problem is, and that's also time consuming, is setting up the machine. So both working on thread veins and anything red and any red blemishes is one setting, but then I have to change all the settings on the machine and change the needle, different types of needles and things to do the other medical removal. So it kind of all depends, but yeah, we work roughly around about 20-minute sessions.
Perfect. And what type of things can be removed with this machine?
So broken capillaries, thread veins, milia, that's a very popular one. I do a lot of milia extractions, blemishes, pigmentation, skin tags, moles.
So a lot of things.
The list goes on and on and on. There's lots and lots of things. So I always say to people, if you're unsure, you've got something, you don't like it and you're unsure, come in, do a consultation with me and we can work from there. Yeah. So also I think it's really important to say is I don't charge per item. So if you've got, a lot of people come in for skin tags, for instance, and they've got like 20 skin tags. If I can do the 20 in that 20 minutes, absolutely fine. It's one price, it's £80 per session. However, if you need a top up, it's then £30 for any additional top ups that you have. A lot of people have seborrheic warts, for instance, and a lot of people have a lot of them on their body, so I tend to do sessions of, so it wouldn't be one session and then top-ups, it'll be multiple 20-minute sessions. But I would explain that in a consultation, so you know.
Is that similar to someone who come in with verrucas?
So verrucas, I tend to use cryotherapy.
That's it.
So I tend not to use. I will use this machine on adults if if the verrucas are quite stubborn. I'll do a combination of. So we'll do a bit of thermocoagulation and we'll do a bit of cryotherapy, and I'll mix it. But certainly on children, we tend to stick to cryotherapy. And I charge for the first session full price, and then I do a top-up session with verrucas.
You know, with things like skin tags and moles, I imagine a lot of people are used to the process of having to go to like the doctors and have it cut out, and then you're left with like a scar and things like that. So with this, are you left with scarring from this treatment?
None at all. So first of all, it's important to say that doctors, if it's doctors don't remove them. If it's for cosmetic reasons.
It's quite an old,
so they don't remove them anymore. And you're right, when they did remove them, they used to dig them out and put a stitch in, and then I've had that done myself.
I've still got the scar on my back.
And put a stitch in and kind of leave it there. Now, with the way we work here, what happens is it'll take away the feed, so the blood feed, so it cauterizes it. What will happen then is that this is for skin tags and moles. What happens then is it turns a bit greyish, and then it'll form a scab, and it'll look like a spot that you've picked, to be honest. Now the important part is when it's in a form of a scab, is that you don't pick that scab. If you bring that scab too early, then what will happen is you do run the risk of having a small scar, because your skin wasn't ready, it hadn't healed properly.
Scab, isn't it?
That's right, 100%. If you take a scab off, you're going to get a scar afterwards. So no scarring. There's no downtime other than with the veins. You might be a little bit pink afterwards. It's a really simple process.
Perfect.
It really is.
Exciting.
So with the veins, things, I think, people don't understand what actually causes them. And some people have got loads, some people have just got a couple. So it's usually trauma to the skin. So for instance, all you people out there that go and do your best to squeeze a spot that's not ready to be squeezed, you're going to run the risk of having broken capillaries. Smokers are really prone to them, and it's because smoking actually thins your skin. So as we get older, we also get more prone to them because our skin gets a lot thinner, so they become more visible. Opening that oven door, that's the worst one. So you open the oven door, you get a massive gush of heat, so that intense heat again can cause them. As in reverse, if you're going into intense cold all of a sudden, that can cause them as well.
All these people doing their ice baths.
Yeah, so it's basically intense heat and intense cold, and any trauma to the skin causes them, as does aging, but aging causes everything. So pretty much that's everything, I think that you need to know about the broken capillaries, other than how I'm going to do it. So what I'm going to do now is I'm going to set my machine up, and what we do is I'm doing obviously the red treatment today. So I'll be using a gold needle. All our needles are sterile in unopened packets. So what I do is obviously open the packet, pop a needle in with tweezers. And then what I'll have to do is hand Sarah. So you can see, before I do, I don't know if you can even zoom in on that, Zoe. It's so fine and minuscule, that needle is. And I'm not inserting the whole of that needle into Sarah anyway. I'm just going into the surface through the tip of it. Okay, now because I'm using electrical current, I need to ask Sarah to hold this. All she has to do is maintain contact with it. And as I say to most of my clients, and anybody who's been to me will know this, it's like the earth to a plug. I'm not going to electrocute her or anything like that. So now that I've done that, I'm going to start my treatment on Sarah. Right, so I'm just going to wipe over the area. And now I'm just going to treat. So you'll hear a little bleep in the background. And just like that, it's gone.
Amazing.
Okay, so now I'm just going to carry on now and work on Sarah's nose. So Sarah, while you're there, I know I've got my hands kind of all over your face here, but can you explain what this feels like?
Gosh, some of it I can't even feel. But the bits that I can feel, it's just like a tiny little sharp scratch. Yeah.
Can you feel the heat coming through, or more just
Yeah, a little bit of heat, nothing major, mostly just like little scratches.
So you wouldn't say it's painful or uncomfortable or anything?
No, I'd say it's manageable, definitely.
Yeah.
You do have a good pain threshold as well, mind. But yeah, it shouldn't be painful by any means. I've never had anybody who's thought it's really painful, but you'd kind of know that I'm doing it.
Amazing, look at that.
There we go. So they've all gone. So this tiny bit there, and it's really important that I find these tiny bits, because what we don't want to do, as I explained earlier, is I don't want these to feed back again. So
Would
I
that
want
mean
them
that
to
they
go.
would get bigger? Oh.
They wouldn't get bigger. It just means that they would come back.
The nose is definitely a bit more
Oh,
sensitive,
the nose
isn't
is
it?
really more sensitive than any other area. It's because it's not the biggest fleshy area. That's why.
Find
So
that
when
with
I'm
most treatments, don't you?
so when I'm working on people's cheeks and things, it's you wouldn't really feel it. Some people have really strong ones coming out of their nose here, and I find that people like nose blowers, for instance, they have really strong ones because they're blowing their nose all the time and causing a bit of trauma to it. But yeah, when you're working in this area here, coming through the nostril, that's really quite a little bit like sore. But yeah, that is it. So it's as simple as that, to be honest. And as you can see, the area's gone red. Like I explained, it would go red. So hence, when I'm working over somebody's face, it's, as you can imagine, it's really hard then to see the rest of them because she's gone pink. But yeah, otherwise that looks really, really good. I'm really happy with that, Sarah.
Thank you.
Yeah, you're more than welcome.
Amazing.
So that is obviously today's session. So it's probably a little bit shorter than most sessions we do because I was doing a demonstration. If you've got any questions or you want to book in for this, just book in for a medical removal. It'll include your consultation. And you're not obliged to have it on the day if you don't want it. However, I do say to people, sometimes it's best just to have it, because if you go away and think about it, you're like, oh, I don't know. Oh,
Finding the time.
Yeah, that's right. And everybody who's had it done, they always tend to say to me afterwards, oh my God, why have I waited so long? I should have done this years ago. So book in, have it done, and yeah, I'll look after you.
And let us know if there's any other demos that you'd like to see.
Yeah, definitely.
Drop us a comment or...
Yeah, we're trying to do a few more live demos, and obviously we'll get Sarah and Zoe doing them, and I'll go behind the camera. Thank you very much for watching, everybody.